Hello, everyone. Happy 420. Happy MOGAD Awareness Month. My name is Samira. I am a patient living with seronegative neuromyelitis optica spectrum disorder. This is a rare autoimmune disease that affects the optic nerves and spinal cord, leaving, unfortunately, some patients blind and or paralyzed. Although I was diagnosed 10 years ago, I'm really happy to share that I've been in remission for 5.5 years. Thanks to modern medicine, and of course, the NMOSD community has seen a lot of advancements. We now have 4 FDA-approved therapies that are highly efficacious. MOGAD has wonderful clinical trials happening right now, and I suspect that in a few years, we'll also see some FDA-approved MOGAD therapies. Welcome to Let's Talk About Cannabis 420 edition. I just want to start by saying that this is a completely safe space, judgment-free zone. We've brought in an expert who is a doctor, who is a neurologist, who treats neurological conditions, who will speak about the use of cannabis and medical marijuana in the setting of a neurological condition or conditions. So Dr. Boster will present for us. You have the opportunity to ask him questions. And again, there is no judgment here. No one will get in trouble for asking anything. And yeah, you're in a very safe space. So again, thank you so much for joining. And I will actually pass it off to our webinar host, my friend, my colleague, and fellow NMO patient, Kayla Miller.
Hello, hello. So my name is Kayla. I'm also a patient living with seronegative neuromyelitis optica spectrum disorder. I received my diagnosis in 2020 along with longitudinally extensive transverse myelitis. I utilize a rollator walker as much as possible and an electric wheelchair for long distance. I've enjoyed raising awareness and patient advocacy for the last few years. I'm the ambassador of Michigan with the Samara Foundation and part of Amgen's NMOSD Won't Stop Me campaign. I've been super excited for this webinar because patients and caregivers have shown such an interest in learning about this topic. I have been able to live a better quality of life with the assistance of cannabis and cannabis with CBD. I'm hopeful that as research advances, any patient may have this as an option for them in the future, if not already in their state or country. Before I introduce you all to Dr. Boster, who is a neurologist and MS specialist, I just want to remind you that this is a recorded session and it will be available for replay on TSF's YouTube channel. So make sure to hit that button, hit that like button and subscribe to see more, and also available on TSF's global website. And again, toward the end of the webinar, we will have a Q&A session where we'll get in as many questions as possible. So without further ado, please join me in welcoming our featured expert, Dr. Aaron Boster.
Howdy, thank you for having me.
Absolutely. If you had slides, you can go ahead and use those. Otherwise,
we're not going to use slides today.
Okay.
Why don't I spend a few minutes sharing my journey as a medical marijuana recommender in the state of Ohio, as a neuroimmunologist and MS NMO specialist. And then I would love to open up the discussion and field any questions that people have. So I'm an allopath, I'm an MD. Also, just to kind of place things, I went through my formal medical education in the 90s when drugs were bad, just say no. And when I remember very clearly in the state of Ohio when they first started to talk about medical cannabis. So that started to become a discussion about people using cannabis for medical purposes. And there was a law passed that made it available for medical uses. And I, being the nerd that I am, looked at the clinical data and decided summarily that I would not participate. Absolutely not. The data was abominable. It was a lack of efficacy, a lack of evidence, and I just didn't feel comfortable. I didn't feel like the science supported the idea, and so it was very easy for me just to say no. So fast forward a couple years, and I had a series of very weird, unique experiences in my clinic, where I would be in a room with a patient of mine. Very specifically, I remember a gal in her mid-70s, a lovely woman that I've taken care of for a very, very long time. And it was just me and her in the room. And she said, Dr. B, can I share something with you? I said, well, of course. She goes, I don't take your Lyrica anymore. I said, well, what do you mean you don't take my Lyrica anymore? She goes, well, my grandson stopped. He came and visited me and he gave me a doobie. And I will hit this little doobie a couple times before I go to sleep. I sleep perfectly. I don't have any pain and I don't need your Lyrica. What should I do? Now, this woman goes to church 3 days a week. She doesn't drink alcohol at all. She is absolutely adherent with her therapy. And she was sharing with me something, and I really struggled to like conceptually understand what to do. What's weird is within a week or two, I had another woman, also over the age of 60, who had nearly an identical experience. And every couple weeks, I started to hear from older women who were confiding in me secretly that they had discovered that if they used a cannabis product, that they could manage many of their symptoms better. So I decided that one of two things must have happened. Either A, several of my patients who don't know each other got together and they had a conspiracy to all tell Dr. Boster the same thing, or maybe they were sharing with me an experience that was beneficial to them and I needed to be a better listener. So after thinking about it, I went with option B and I went back to the clinical literature. Now, the reality is it had not gotten any better and the scientific evidence for cannabis is lacking. But I made a decision that I was going to listen to my patients. And I started to do the continued medical education learning things, and I got certified and licensed to be a recommender in the state of Ohio. Now, that was several years ago, and we haven't ever looked back. So I run a standalone MS center where we care for families impacted by MS, families impacted by NMO, families impacted by MOGAD, and our goal is to help them live their best life despite having that condition. And we're not proud. I'm going to use any tool necessary to try to help you live a better life and not allow NMO or not allow MOG or not allow MS to make decisions for you. And what I have discovered over the past several years as a medical marijuana recommender in Ohio is the following. Cannabis is not magic. Cannabis does not slow down these conditions, but cannabis is remarkable at treating several symptoms. And so what are those symptoms? I find cannabinoids to be extremely valuable in helping control spasticity. Spasms, cramps, Charlie horses, stiff legs are unfortunately profoundly common in people impacted by MOGAD and people impacted by NMOSD and people impacted by MS. And about 70% of MS patients will experience some form of spasticity. Now, I live in the great state of Ohio where it gets hella cold in the winters, and that makes spasticity worse. And many, many of my patients have found value and benefit in controlling their spasticity using cannabis. And we can get into some specifics later. I have also found that cannabis is very successful at controlling neuropathic pain. Now, NMO is a disease that in some ways is defined by pain. It's a very painful condition for many, many patients. And it's a terrible, awful pain because this is neuropathic pain. People feel like their leg is on fire. They feel like they're being crushed. They feel like their leg is being frozen, these terrible things. And so treating neuropathic pain is very, very important. And I have found time and time again that cannabinoids can be extremely valuable, not just to spasticity, but also neuropathic pain. One of the most fascinating places where cannabis is used in my practice is in irritable situations. Now, let me explain what I mean. I have a wonderful patient who has taught me a lot about cannabis. And he said, Dr. B, where it helps me the most is in difficult, annoying situations. And I said, what? He said, well, let me give you an example. He likes to ride a Peloton bike. Now, when I say he likes to ride a Peloton bike, he races the Peloton. He's legally blind, but on the Peloton, he can rock it. And he will do these virtual races frequently. And he trains on the Peloton almost every day. But he shared that after 30 minutes of hard pedaling, his right leg starts to literally burn. And it would become so bothersome that he would stop exercising. Well, here's the deal. When he uses cannabis, it doesn't bother him. And I said, oh, it treats the pain. He said, absolutely not. It still hurts. I just don't care. And that I thought was fascinating. And I have heard that time and time again, that cannabis can assist people in dealing with difficult sensations and situations. I have also found cannabis to be extremely helpful with anxiety. Now, the reality is people impacted by neuromyelitis optica, people impacted by MOGAD, people impacted by MS are at very high risk of anxiety and depression. And whereas I don't find cannabis to help with depression, it is fantastic at dealing with acute and chronic anxiety. Lastly, I have found very good success in using cannabis to help with insomnia, something that plagues the vast majority of my patients. And so, we at the Boster Center for MS have adopted cannabis as a beautiful adjunct, as a beautiful assistance, as a beautiful symptomatic management in helping people live better lives. So with that little introduction, let me turn the mic back over to you. And if there are questions, I am ready to go to answer them. Kayla, would you like to queue up some questions from the audience, or how would you like to take next steps?
Absolutely. So if anyone has any questions, you can go into the Q&A at the bottom of the screen and you can type them in there. Or if you like, you can type them into the chat.
It looks like Mary Lou has her hand raised. I don't know, are we able to call on people that they can say their question?
Yeah, absolutely. Hold on. Mary Lou, I'm going to call on you. Allow to talk. If you could just unmute yourself. There you go.
Okay.
Go ahead.
Howdy, Mary Lou.
Hello.
Hi, how are you?
I'm good. How are you?
Wonderful. Thank you for being here. What's your question?
So I know that I've experienced it about a few years ago, but I didn't know if it interacted with taking like baclofen, um, gabapentin. So I kind of just stopped my use of it just because I had some fear that it was gonna maybe affect or give me any side effects with the medication that I was taking. And then I started Solores too, so I didn't want it to interfere, and I didn't know if it did.
So I want to commend you for taking your medical care seriously. That's excellent. And if a doctor ever tells you that a medicine or an herb or a supplement doesn't have a side effect, they're lying. So I think it's very wise of you to ask that question about could these medicines act sassy together? Now,
It,
I can't give you medical advice as I don't have all your pertinent information in front of me, but I can make some generalized statements that one of the things that we think about, particularly with CBD, is elevations to liver enzymes. And so we just want to be cognizant of impact on liver. And it's easy enough to check liver enzymes. Now,
mhm.
many of the medicines that you mentioned are metabolized by your liver. And so it would be simple enough every couple months just to get a set of labs to make sure that everything's gorgeous and not a problem. I would share with you that in my clinic with those list of medicines, I would not have concerns with my patient using cannabis. But of course, you have to talk to your neurologist to make sure that the two of you are aligned. Again,
Okay.
I also want to point out just a couple other, if you will, side effects that one can see in the setting of cannabis. And fortunately, they're not very, very common. You can see a tolerance with cannabis, just like you can see a tolerance with gabapentin.
Mhm.
Where if you take it, you can become tolerized to it, and you may find that you either need to take more to have the same benefit, or my preference is we take a drug holiday for a couple days, and then we revisit it, it can work more.
Okay.
Very, very rarely, and I'm talking like rarely, we can have a weird phenomenon in patients that use cannabis on a very regular basis. And they can have a phenomenon where they wake up and they have profound nausea and even vomiting. And this can carry on for most of the morning until they take a hot shower. That's a very, very unusual symptom. I've maybe seen it only in 2 patients. But by and large, we're dealing with something that's I find to be relatively safe. One last comment as we think about side effects is the route of administration. So whereas I am a big proponent of using cannabis to help with symptoms in these conditions, I am not a proponent of lighting a carbon-based cannabis product on fire, billowing
Mhm.
smoke, and then sucking in the smoke. Because sucking in smoke, whether that be cannabis or tobacco smoke, is very, very pro-inflammatory, not just
Okay.
to your lungs and your blood vessels, but also to the holiest of holies, the supercomputer, the brain and the spinal cord. That was a great question, Mary Lou. Thank you for asking it.
Also, one more question. She also recommended doing the medical marijuana. They're like the little pills. So I did that for maybe about a week, but I was starting to hallucinate because I would do it at nighttime. So it was hard for me because I had trouble sleeping, but that did not work. So I stayed away from those. I still have them in my fridge. So,
Bring up a really important point that if you had a twin sister that had the same NMOSD as you would have different experiences, and you would have different experiences with cannabis. So one of my pro tips is when you go to a dispensary and settle on some purchases, you need to have a bedside notebook, and you need to write down what brand, what you used, how much you used, and then the impact, because your experience will be unique to you. That doctor probably had other patients that benefited from oral edible, and in you, not so much. And so I think there's a learning process for each individual to dial it in.
okay, thank you.
Absolutely. Thank you for asking.
You're welcome.
Okay, so next I'm going to call on Ilona from Virginia. Ilona, do you-
Hello. Am I on mute?
We can hear you. Welcome, welcome.
Thank you. I had a question because I'm not a good flyer. And so the last couple of times where I've flown, I try to do things holistically. You know, I buy the bands, for nausea. And like this last time around when I flew, I get while we're in flight, I always end up getting these I don't know how to do episodes of like I get all cold, like it's like I'm freezing. I start sweating. I start to get a little bit of nausea, and then it's all I can do like to try to keep myself calm. Like my people that fly with me, they're like you're insane. Like you just get zoned. Like you just stare straight ahead, and you kind of like breathing not to hyperventilate and that kind of thing. And so I'm trying to do things naturally. Is there anything that might help me with that? Because now I'm scared to death. Of course, I don't want to fly because also when I feel like that and after I land, it takes so long to get over that feeling. Like I just can't shake it.
Based on what I'm hearing, it sounds as if you're having some very serious anxiety and near panic associated with flying, which is unfortunately not uncommon amongst humans. Identifying that you're having some concerns surrounding flying allows you, with a therapist, to game out how to overcome that. There are a host of cognitive behavioral techniques that one can use to get yourself comfortable with flying. Now, today we're having a conversation on 420 about cannabis, and so I can only assume that baked into the question, pun intended, that you may be asking whether or not something like cannabis could help with anxiety. And
yes, exactly. Yes.
it certainly can. Now, a couple of really important things. I practice in the United States of America, and whereas in the state of Ohio, cannabis is medically legal, it is still federally illegal. And so it is paramount that my patients in Ohio who purchase cannabis products do not cross the state line into another state. So if you find that you could use a cannabis product to help you with the anxiety associated with flying, we're going to need to dose before you enter the airport. You certainly would never, ever, ever want to bring that product to the airport or fly with it.
Okay.
And so if you can game out a way, and I'm going to make up some stuff, that you take an edible before you fly, and then someone drives you to the airport so that you're not driving medicated, then you may be able to benefit from some cannabis to help you get through the anxiety of that flight.
Okay, thank you. I went to Colorado. The reason I asked, I went to Colorado for the AAN meeting, and people are like, oh, well, take this opportunity to go out and purchase something. And I'm like, I don't even know where to start. So I just was like, oh, let me try
Let's field that question. So when you think about using cannabis to help with anxiety, I really feel like we have to delineate, are we talking about an acute panic attack, like, oh my God, right now, or a generalized chronic anxiety sort of in the background hanging over your head? Because I have found different techniques to treat those two different things. So when someone has the sudden onset of impending doom and a horrible anxiety or panic, we don't want to take an edible and then wait 45 minutes for it to kick in.
Yeah.
So instead, we need something that works a little bit faster. Now, there's a couple ways to do that. I do not recommend smoking cannabis. Now, excuse me, smoking cannabis is very fast. You're going to see onset in about a couple minutes. But again, it's very, very pro-inflammatory. And here we are desperately trying to decrease inflammation in your body.
Yeah.
A different way to get a fast onset is to use a vape pen. Now, a vape pen is still a contentious discussion. And if I had a pen, like I would use it as a prop, but it literally looks like a pen and you suck on it. And when you suck on it, it heats up a liquid cannabis product below the level of burning. So it doesn't combust it. There's no smoke. It just heats it up enough that it vaporizes the liquid into a vapor that you can breathe in. And the onset of action is almost as fast as a blunt or a joint. So as equivalent of an analog marijuana cigarette, you're going to have a fast onset of action. Now, many patients ask me, well, Dr. B, is that pro-inflammatory? And it may very well be. I just think it's probably less pro-inflammatory than smoking. I have some patients, however, that are very, very reluctant to want to breathe anything into their lungs. And I understand that. And there's another option for a fast onset of action. And it's something called tincture. So tincture is an old apothecary term. And you can get a tincture of cannabis, which is a glass bottle of a liquid cannabinoid solution. And then there's an eyedropper. And so you can pull up a set of liquid and you put it under your tongue. There are giant blood vessels under the tongue. And so about 15 to 20% of that cannabis tincture will be immediately absorbed in the blood vessels and kick in almost as fast as a vape pen. And then you swallow the rest, boom, and the rest of it will kick in about 45 minutes to an hour, just like an edible. And so if we are trying to target an acute anxiety or an acute panic, I oftentimes recommend, if we're going to treat with cannabis, to use a vape pen or tincture. Now, I have other patients that struggle with anxiety, but it's not an acute panic attack. It's kind of like a chronic gnawing at their life, and it's in the background. And it can interfere with sleep. It can interfere with just getting through their day. And in those cases, we don't generally recommend a vape pen or a tincture. I spend more time talking about using edibles. So most dispensaries in Ohio offer edibles in 10 milligram gummies. So you hear about someone talk about like a cannabis gummy. And 10 milligrams is the unit of THC. And this can be very, very helpful. I ask patients to buy a tin of gummies and then break one in half, and at night take one, and don't do anything else weird the rest of the evening. No more cannabis, no alcohol, no other medicines except for your regular stuff, and you go about your normal evening routine. Have your dinner, eat your food, wash the dishes, watch TV, whatever you're going to do. And I want you to write down, when did you notice it kicked in? When did you notice it peaked? When did you notice it went away? And were there any side effects? And by virtue of doing 5 milligrams the first night, 10 milligrams the next night, we can dial in the impact, the benefit, the success of the cannabis. And I can help guide my patient to use it just like a baclofen pill or just like an anxiety pill. And I have many patients that will benefit from, for example, using a edible cannabis once, twice, or thrice daily to help them with chronic anxiety. That was a great question. And thank you for asking.
Well, thank you.
We have another question. When you say you prescribe cannabis, what specifically do you mean?
That's an excellent question. So in the infinite wisdom of the government of the United States, cannabis federally is still considered a scheduled substance, and like heroin. And so I'm not allowed to prescribe someone heroin, like 1 pound morphine, right? I can't do that. So similarly, a doctor in the United States is not legally allowed to prescribe cannabis. And so the workaround is we recommend cannabis. So I will explain to you how it works in the state of Ohio, although it's my understanding that many of the states have used a similar setup. So if someone has a qualifying diagnosis, and every diagnosis that we've discussed today qualifies, so NMOSD, MOGAD, MS, spasticity, transverse myelitis, they all qualify. Then you can be registered by a recommender, into the Ohio Medical Marijuana Registry. And that recommending doctor can then recommend your use of cannabis for that indication. Now, what happens is you end up getting an electronic card on your phone, and you take that electronic card to the dispensary where there's typically an off-duty police officer who will look at your driver's license and your card and then allow you entrant into a dispensary. Now, once you've entered the dispensary in Ohio, you can make purchases of cannabis products up to a certain allocation, and that's a rolling 45-day period. And the cannabis recommendation in Ohio is typically good for about a year, and then you can always renew. So that's the way that the process works for medical marijuana in the state of Ohio in 2024.
Cool. Can we, Sandra, are you here?
I'm here. Sorry, I kept muting myself because I'm like, I thought I was unmuting myself. Hi, I'm here.
Hi, go ahead.
Hi, this is so great. Thank you so much for having this, Samaria and Kayla and Doctor. My name is Sandra. I've had NMO for 15 years now. I was misdiagnosed with MS. And, for me, my cannabis history or use, I would say, has been very beneficial for me. I have been using, I've been on disability now for 7 years, and I started using about 6 years ago. And in my case, and I love how you're talking about the tinctures and everything, because what I'm looking for is to stop the smoking part of it and inhaling, but I find that edibles don't work for me. And I can't find anybody to do the ratio of what the tincture will work for me. Because as you said, like the doctors really can't tell you what to get or don't really tell you what to get. But in my experience, the cannabis I use for pain. I also use it for my anxiety, and it's not just a moment of anxiety, panic attack. It's just ongoing anxiety. Mm-hmm. And I know you said that it doesn't help for depression, but for me, it has helped me just if I'm smoking like a sativa or something like that to get me out of that mood. But for me, it's gotten me off 5 medications, you guys, in the last 6 years. I have not taken Xanax in over 4 years, and I used to take, believe it or not, 3 milligrams of Xanax a day to help me with my tingling sensations, to help me with my pain and my numbing. And I was like addicted to Xanax. It's unbelievable how much they gave me. And I honestly have not taken a Xanax in 4 years. So for me, cannabis has been a great experience, although I am trying to get off the smoking part because of how bad it is for us. But I don't have any idea where to start with a tincture because I've tried and they just don't work for me. So if you could help me with that, I'd be super, super grateful. Thanks so much again for this opportunity.
Thank you for sharing your experience. And, what I would fall back on is the importance of your own life experience, keeping track of, for example, tincture. So if I was to give you a suggestion, I would start off by doing a 1-to-1 ratio of CBD to THC. And I'll start talking to you about those 2 cannabinoids in a second. And then I would, based on that and the response, then I might change it. And I might start to go THC heavy or CBD heavy and see about the response. Now, obviously, this is going to be a trial and error unique to you, but I commend you for trying to stop smoking and looking for another option. So best of luck to you, and keep records and notes so that you can figure out what works and what doesn't. Let me take a moment, if I may, before we do the next question, just to talk about cannabinoids, because we've now talked about CBD and THC a little bit. So if I can spend a few moments. So let's talk about like Cannabis 101, all right? And like a little bit of the science, if you will. So this is really interesting. There are all these different systems in the human body. So for example, there's the cardiovascular system, which pumps blood around the body. There's the digestive system, which gets nutrients out of food and helps you poop out the waste. There's the immune system, which is aberrant in NMO, and it's aberrant in MS, right? And so we're trying to alter the immune system. Well, there's another system in the body that most adults have never, ever heard about called the endocannabinoid system, right? So the endocannabinoid system is a set of receptors throughout the entire human body. And when you stimulate the endocannabinoid receptors, you modulate other systems. So you can modulate pain response, inflammatory response. You can modulate metabolism. You can modulate sleep. And so the endocannabinoid system, at least evolutionarily, is considered a way of tweaking the current systems in the human body. And the human body makes something called endocannabinoids. So Tell your mom and dad, you make your own cannabis. You make endocannabinoids that bind to these endocannabinoid receptors. Okay, now there's a plant which grows like a weed, all right? It's called cannabis, and the cannabis plant makes chemicals called phytocannabinoids. So not endocannabinoids that are made in your body, but plant cannabinoids are called phytocannabinoids. And when you examine a cannabis plant, so pretend I'm holding a cannabis plant here, there are literally hundreds and hundreds of different cannabinoids. So the reason that we joke that 420 is the cannabis day is they used to say there's 420 different chemicals in a cannabis plant. There's actually more than that. And all the chemicals are phytocannabinoids. Now, these phytocannabinoids, when you ingest them into the human body, they bind to your endocannabinoid receptors, which is really fascinating. Now, when you look at a cannabis plant, the two highest concentrations of cannabinoids are a chemical called THC and a chemical called CBD. Now, there's actually gazillions like CBN and all these other ones, but I'm going to focus today on the two biggest ones, THC and CBD. So THC is a phytocannabinoid that binds in the human body to Th1 receptors. Okay, so there are specific receptors that the THC binds to, and those receptors are located throughout the body, including the brain. And when they bind to Th1 receptors, it can cause euphoria or a medicated feeling. Sort of the psychoactive properties associated with cannabis come from THC binding to Th1 receptors in the brain. There's another very common cannabinoid, which you find in cannabis, called CBD. Now, CBD does not bind to Th1 receptors in the brain. They bind to CB2 receptors, which are not located in the brain. And so CBD has no psychoactive effects. It doesn't make you feel medicated, or if we use a term from the 90s, high. And CBD does something different than THC. Now, I have found excellent use of CBD-only products for several things in the setting of MS and in the setting of NMO and in the setting of other neuroinflammatory conditions. And I have found different benefits when I combine CBD and THC. Some patients in Ohio, despite being eligible for a medical marijuana card, don't wanna, which is fair. And many of those patients will still find some degree of benefit using a CBD cream for pain, or using a CBD edible for anxiety or insomnia. And so there's a lot more to be discussed as it relates to the science of cannabinoids, but I just wanted to kind of lay out some basic groundwork as we start to have these discussions with all these funny letters.
That is so insightful, and I think it's really helpful because that was some of the questions in the chat about really what is the difference between the CBD and the THC. So thank you for that. I actually kind of like this notion of bringing people on so that they can ask you questions directly. So Aisha, I am gonna pick on you next. Just let Dr. Boster know where in the world you're calling in from, what do you have, and then of course your question.
Hey everyone, first of all, thank you so much for this opportunity, Sumaira Foundation, Sumaira and the Dr. Aaron. I have a question. I come from Bosnia and Herzegovina and I live in Sweden, and medical marijuana is kind of legal, but it's very hard to get. And sometimes I would maybe smoke a joint or something just because I know that cannabinoids can help relieve the symptoms, but I've noticed that my pain in my joints increases, or I feel it more. So I've just wondered if that is something that you have encountered with your patients. Otherwise, I started to use CBD oil now, and I think that helps me with insomnia. Yes, thank you.
Thank you for the question, and thanks for being here today. Many of my patients have found CBD to be a highly effective sleep aid. And they'll use the CBD instead of melatonin or with melatonin. Both are very natural. And my fave is when they use the CBD for sleep as opposed to a prescription medicine like the Ambiens and Lunestas of the world. And so I absolutely have had many, many patients benefit from taking 1 to 2 CBD only gummies before bed for sleep, very similar to your experience. Now, your comments about joint pain when smoking cannabis is not something that I've heard, but you're not a textbook, you're a human, and that is absolutely your own life experience. And it highlights the importance of making notes about what experiences you have when you're using cannabis, because you can't turn to someone else to learn about your life experience. And so it's my hope identifying that you say, haha, and then you can shift to try different ways of consuming the cannabis.
Thank you so much. It's mostly my foot joints that usually hurt, but I've noticed if I smoke that it just gets worse. But yeah, thank you so much.
Fascinating. Best of luck.
Thank you, Aisha.
you.
Okay, next I'm going to call on Nada. So Nada, let us know where you're from, what do you have, and then you can ask Dr. Boster your question. Just unmute yourself.
Yeah.
Howdy, Nada.
Hi, I'm Nada and I'm in Australia, where cannabis, well, I don't know if it's cannabis or if it's CBD oil, it is legally available, but it has to be approved by the Federal Department of Health. It's not easy. And, you know, you say your patients have an authority on their phone. We get a prescription which is kept at the pharmacy. We can't take, you know, we're not allowed to take it ourselves to another pharmacy. My question is the quality control of cannabis products as rigorous as for normal prescribed pharmaceuticals? For example, is the claimed dosage as accurate?
That's an excellent question. Now, one of the advantages to an FDA-approved medicine in the United States is that I can look you in the eyes and guarantee that the dose is what it says it is. Moreover, I can tell you about the way that it works in the human body because during the investigations and clinical trials, we clarify all that stuff. So when a neurologist says, here, the baclofen will do X, Y, and Z, they say that with authority because they have a tremendous amount of science leading up to the approval of that medicine. In direct counterpoint, if you talk to dealer Dan at the street corner and he's got some weed that he can sell you, you don't have a lot of information about dealer Dan's weed. You don't necessarily know the dose or concentration or quality or any of the potential risks of how it was grown, et cetera, et cetera. So one of the advantages to going to a dispensary here in the United States is that there is a quality control. So when they say that the gummy is 10 milligrams of THC, they've proven that. When they say that there's a 1-to-1 ratio of CBD to THC, they've proven that. And I find that to be very reassuring. So when someone uses medical cannabis here in Ohio, not only are they avoiding doing something that's illegal, not only are they avoiding not knowing, but they're gaining a lot of information which they can feel comfortable with that it really is a 10 milligram gummy. That was an excellent question. And thank you for sharing your experience in Australia.
Could I have a follow-up question?
As long as Sumera says it's okay, I'm game.
Yes, no problem.
It's only short. If you use cannabis in whatever form, is it okay to drive or operate machinery? And is it legal?
That's a great question. And I would caution against that. So cannabis can help you with several things, but it can also sometimes impair sensorium. It can sometimes make you kind of foggy in your thinking. And so I want to give a very clear message that I would not recommend using a cannabis product and jumping in a car. Now, let's be honest. I would also not recommend that you take a new dose of Lyrica or gabapentin or baclofen and jump in a car. But, you know, at least in the state of Ohio, they're working on trying to figure out cannabis laws, and you can actually be ticketed or arrested or something for driving under the influence of cannabis. So I definitely want people listening to be cautious.
Even CBD oil?
Not CBD oil, no. So my experience in the science with CBD is the opposite. CBD only has no psychoactive properties at all. So you could literally take CBD and then take a math test and you would do fine. It does not impair sensorium.
But does it help with anxiety?
In my experience, many patients benefit from anxiety when they take CBD. Not all patients, but many do. Absolutely.
Because for me, the psychoactive effect of THC is really very unattractive, and I'm not interested at all.
So you may try either a concentration where there's low THC, high CBD, like a 30-to-1 ratio, or you may try CBD only and see if you can benefit from that.
Thank you very much.
Thank you, Nada. Okay, next we have Arthur. Do you want to do a very quick introduction?
Hey, hi. Yeah, I'm Arthur from Los Angeles, California, and there's the working diagnosis is NMOSD, so they're still not 100% sure. So I wanted to ask, wanted to go back with the smoking part. I haven't smoked it since last year, since this whole thing started for me, and I I'm around people that do smoke it, so I'm assuming I should stay away from that too, right? Which I have been trying to do. So yeah, that's my question. I had other questions, but you pretty much answered them with other people's questions. Thank you.
Arthur, thank you for jumping online. And I'll share with you that I covet your weather oftentimes, living in Ohio. Let me speak from the space of multiple sclerosis, but we can extrapolate this information. There's a very unpleasant phenomenon that people impacted by MS who smoke risk doubling the speed of their disease. Allow me to repeat. Smoking can speed up multiple sclerosis. It's very, very pro-inflammatory. Now, the data for what I just said comes from tobacco smoking, right? So they look at people with MS who smoke versus not. But I feel like we are obligated to apply the same logic to anything that we're smoking. And so I recommend that people impacted by multiple sclerosis, and by extension, NMOSD and MOGAD, avoid exposure to smoke and secondhand smoke. And so I think that you're wise for trying to abscond or not be in the same room if possible.
Cool, got it. Thank you so much.
You're welcome.
Thank you, Arthur. Okay, next, Letitia. Do you want to introduce yourself quickly? Oh, hold on. Hi, Letitia.
Hi, can you guys hear me now?
Yes.
Okay, perfect. Sorry. Yes, I'm Letitia. I'm from South Africa. So cannabis was legalized in our country, I think 6 or 7 years ago. Or well, like nothing's really gonna happen to you if you get caught with it. Someone earlier asked a question and she said that it was causing nerve pain to her legs or spasms to her ankles. And so CBD here for us is really expensive to get. So I prefer to use the THC oils or the edible gummies. And I've tried twice now, this year or maybe last year as well. I've tried inhaling it and it's actually made me feel sick. So I had like a terrible headache and then also got nauseous. Nothing really in terms of cramps or nerve pain, but it did make me feel sick only when it came to inhaling it. So maybe I'm not sure why that is. Is there like a difference between the administration of like the drug?
So that's a great question, and it allows us to have a conversation about the different routes of administration. One of the biggest differences when you smoke cannabis is you're not just inhaling THC and CBD, you're also inhaling a bunch of carcinogens and a bunch of carbon-based stuff, which is very pro-inflammatory and kind of yucky. Also, when you smoke cannabis, the peak concentration in your blood skyrockets. Much, much higher than you would ever see with edibles. And so not only are you exposing yourself to other carcinogens and nasties that you don't want to breathe in, but you're changing the concentration exposure. And so both of those things could result in some unpleasant side effects. You bring up an important comment that I had left out earlier, and so thank you for helping remember, to talk about topical cannabis. And so there are topical applications of THC CBD creams and CBD only creams. And I have a lot of patients that suffer from neuropathic pain where their leg or their arm feels like it's burning. And so we offer a CBD cream in the clinic, which we'll give someone a squirt of to rub on their arm just to see if it helps make the pain decrease. And I would say to you that the majority of people that try it are shocked at how much it helps them, which is kind of neat. So that's another option when you're trying to use a cannabinoid product to help with discomfort.
Great question, Letitia.
Thank you.
Love that you're here. Okay, next I'm going to call on Anissa. Anissa, can you unmute yourself? Anissa is from Georgia. She had a couple of questions.
Howdy, Anissa. Just got to unmute your line and then we'll be able to hear you.
Yeah, she's probably figuring it out. In the meantime, I'm going to call on another person. All right, here we go. Yvonne. Yvonne from California. Come on up.
Howdy, Yvonne.
Hello there. Can you hear me?
Yes,
Yes,
we can.
There you
Okay.
go.
Hi. My question is, can you still hear me?
Yeah.
Okay. So I'm in California. I have MOG, and what a great Zoom. Anyway, I take THC CBD gummy pretty regularly at night because I have horrible insomnia, and that generally helps me. Normally it's like about 4 to 5, maybe 6 milligrams of THC. But I also take baclofen at night for spasticity and, to get muscles to relax. But I always feel a little uncomfortable. I mean, how dangerous is that I don't take it at the same time, but definitely within, an hour of going to bed, I've had the baclofen and I've had the gummy.
So here's my medical disclaimer that I can't give you an answer for you. All right. So now I'm legally okay answering your question in a general sense, right? I don't see a big danger there. Now, the danger could be a concern of taxing the liver, but as I mentioned earlier, I think that can be mitigated simply by following liver enzymes every once in a while. So what you're sharing to my ears does not raise concerns.
Okay. And one quick follow-up question, if I may. The gummies work great for me, but oh my gosh, I also have Sjogren's syndrome, which causes a lot of dryness.
Yeah.
And any secrets or tips about dryness from the gummy type
So
product?
you bring up a really good point. Sjogren's syndrome, which is an autoimmune condition, can cause something called Zika syndrome, which is basically
Right.
like dry mouth, dry eyes, like everything's dried up. When you use cannabis, there's a side effect of cotton mouth. You'll hear people talk about cotton mouth. So really you're adding insult to injury. One of the easy breezy ways of trying to address that is to suck on a hard candy because it'll help stimulate the salivary glands, which you still have. They're just not working as well as you like. And that can help increase production of saliva. Sometimes having a water so that you can sip to wet your palate can be very, very helpful. There are artificial saliva that some patients have found beneficial. Other patients get all wigged out when I talk about that. But you're absolutely right that you're trying to mitigate and navigate those side effects. And I wish you the best of luck.
Thank you so much.
Thank you, Yvonne. Okay, so we have time for one more question, and we're gonna turn it over to Anissa from Georgia. But I'm just asking the audience in the meantime for the remaining, I don't know, 5-10 minutes of our webinar. If this webinar was helpful to you, let us know in the chat. I'm still trying to understand how to provide this kind of information to our community. So any feedback would be super helpful. If there are other things that you want to know about, maybe more specific, let us know and that we can arrange it. But now I will turn it over to Anissa. Can you introduce yourself? Let us know where you're from.
Yes, I'm Anissa McLeod. I'm from Warren Robins, Georgia, and I've had NMO since 2008. And I've had I had relapses from preventative medicines, and right now, I'm just ready to try something that's going to work. And I have trouble with insomnia and it's chronic pain, and I just want to know exactly where do I get started, because I tried to talk to one of my doctors about it, my doctor told me if I do try cannabis, I no longer can come to the pain clinic and get the medications anymore. So I'm just kind of skeptical whether to stop all my medications and go straight to cannabis or what to do. And if I do the cannabis, I don't even know where to start or how to get a card or whatever.
Anicia, you bring up a really important cultural phenomenon that's going on right now. So think back in the United States to prohibition, when alcohol was illegal. And then when they undid prohibition, there was a process when alcohol started to show up back in people's lives.
Mm-hmm.
Now we, looking back historically, say, there was no alcohol, then suddenly you could have alcohol again. But if you lived during the time of prohibition, it was clunky, right? It wasn't like one day everyone could just go drink a beer.
Mm-hmm.
So if we go back in time, not that far in American history, cannabis was illegal everywhere. And it was also stigmatizing, right? Drugs are bad, remember?
Mm-hmm.
And what you and I, what everyone on this call is experiencing is a evolution, a change in culture to go from cannabis being stigmatized and demonized and put on the periphery of culture to making it something which is available for humans. And I think if we were to fast forward 20, 30 years from now, we'll look back and say, oh, I remember when cannabis wasn't available and now it is, and isn't that great? But what you're experiencing, the stigma of a pain doctor saying that's bad, the challenges in trying to figure out how to use this is this whole process that we're in the middle of. So in the state of Ohio, it used to be illegal, and then it was made legal medically. And they just passed a law, which has not gone into effect yet, making it legal recreationally. And so you can imagine Ohioans are kind of feeling, all over the place. I'm sorry that your pain doctor is narrow-minded in their thoughts. I apologize for that. There will be a day when even pain doctors appreciate the value of cannabis to pain, but they don't right now generally. And so you are faced with a difficult problem that bluntly you should not be faced with, which is you have to make a decision. Now, I do want you to enter into this with open eyes because you may need that pain doctor. That pain doctor may be helping you in major ways. And it's a risk benefit of if I'm not allowed to participate in what that pain doctor has to offer, right? I would feel bad, for example, if you severed that therapeutic relationship and then the cannabis wasn't doing all the stuff you needed to do. And boy, you really need that guy.
Yes.
A couple ideas. Doctors are a lot like plumbers. We're just helpers. Like we just help you do stuff, right? So if you don't know how to put in a sink, you hire a plumber, you tell the plumber where to put the sink and you buy the sink and then the plumber puts it in for you. So I'm like a plumber, right? I try to help you out so that you live your very best life. And if you don't like my style of plumbing, go find a different plumber. My point here is you might ask other pain doctors in the area if there's any of them that will consider cannabinoids as part of their therapeutic regimen. Now, you may get a lot of people to say, no, I'm simply saying the world is evolving and you're on the cutting edge of it. And we just need doctors to kind of get caught up.
Yes. Okay.
Thank you, Anissa, and I look forward to meeting you in Atlanta this summer.
Okay.
All right. I would love to just take a moment to first thank Dr. Boster. It's really incredible to meet and engage with doctors who are on the same wavelength that, aren't passing judgment. We have to live with these conditions and deal with all of the different symptoms. So, in my opinion, whatever we have to do to live as comfortably as we can within our diagnoses, I think we should, as long as it's legal and all of those things. So really, really very appreciative of how honest, knowledgeable, and you really created a very comfortable space here, which is very obvious. So thank you, Dr. Boster. Kayla, do you want to maybe come on and say a few things? You've been such a great host.
Yes, thank you everyone for joining us today. Thank you, Dr. Boster, as well, for all the information. It has been a really great session and really good questions and answers. So I learned actually a little bit more. And if anyone has any additional questions, they can email me at kayla@samarafoundation.org, and I'd be happy to answer them or look around and try to find an answer for you. We also have our Facebook group, Let's Talk About Cannabis. And that is a safe place for more questions, or if you find a product that works for you, showcase it, share it with us. I'm really big into tinctures and topicals. They've been really helpful for myself for my neuropathic pain. So
Thanks, Kayla. And then Dr. Boster, the floor is yours. Any closing thoughts?
Let me just say thank you for creating this opportunity to create awareness and to remove stigma and hopefully help some people live a better life despite having a nasty condition. As always, my name's Aaron Boster, and thanks for learning with me today. If you guys want to see more of me, you can find me on the interwebs. You can go to my YouTube channel. It's my name, Aaron Boster, MD. You can check us out at bosterms.com. And of course, all the associated social media platforms. Thank you, everyone. I'll look forward to seeing you online.
You're wonderful. Thank you, Dr. Boster. Happy 420, everyone. Go enjoy your day. Bye-bye.